You're bleeding. Not the kind that fixes with a band-aid and a kiss from mom. The kind that makes puddles. The kind that turns your vision into a tunnel and your legs into suggestions. There's a hole in you that wasn't there 10 minutes ago. And the nearest hospital is either rubble occupied by people who'd rather shoot you again, or 300 miles through hostile territory. No ambulance is coming. No surgeon in scrubs. No morphine drip. Just you, a bathroom cabinet, and the very real possibility that you're about to become fertilizer. But here's the thing about bullet holes. They're surprisingly democratic. Doesn't matter if you're a prepper, a scavenger, or just lucky. The human body leaks the same way. And if you know what you're doing, if you can keep your hands steady and your panic at a simmer, you might just plug that leak long enough to see tomorrow. No worries. We're doing field medicine, apocalypse style. Step 1. Stop the bleeding before you become a statistic. First priority, pressure. Not the existential kind. You've got plenty of that, but physical pressure. Find the cleanest cloth-like object within arm's reach. A t-shirt, a towel, a curtain. Hell, a sock if that's all you've got. Fold it into a thick pad and press it directly onto the wound like you're trying to smother a small fire. Because that's basically what you're doing. Smothering a hemorrhage before it turns you into a deflated meat balloon. Hold it there, hard. Don't peek. Don't lift it to check if it's still bleeding. Of course it's still bleeding. You have a hole. If the cloth soaks through, don't remove it. Add another layer on top. Removing it tears off the clot you're desperately trying to form and you're back to square one. Except now you're dizzier, and the room's spinning like a broken carousel. If it's an arm or leg, elevate it above your heart. Gravity's free and surprisingly effective. If it's your torso, well, you can't exactly levitate your liver, so skip that part and keep pressing. Step 2. The tourniquet, when pressure isn't enough. If the bleeding's arterial, pulsing bright red, spraying like a busted radiator hose, you need a tourniquet fast. Find something 2 inches wide, a belt, a torn strip of denim, a dog leash, not a shoelace, not a wire. Those slice through tissue like a cheese cutter, and you'll lose the limb for sure. Wrap it around the limb a few inches above the wound, between the hole and the heart. Tie it tight, then find a stick, a pen, a screwdriver, anything rigid, and twist it like you're winding a clock. Tighter, tighter, until the bleeding stops. It's gonna hurt. A lot, that's how you know it's working. Mark the time somewhere visible. Sharpie on the skin, blood on the wall, whatever. A tourniquet left on too long kills the limb. You've got maybe 2 hours before the tissue starts dying. After that, you're choosing between bleeding out and amputation. Fun times. Step 3, clean the wound to remain, or invite infection to the party. Assuming you're not dead yet, congrats. Now it's time to stop sepsis from finishing what the bullet started. You need to irrigate the wound. Translation, flush out the dirt, fabric, and whatever else hitched a ride into your body. Boil water if you can. Let it cool. No stove? Use bottled water. No bottled water? Tap water is better than nothing, even if it tastes like rust and regret. Pour it directly into the wound, not a dribble, a stream. You're trying to wash out debris, not baptize it. If you've got saline, use it. Hydrogen peroxide? Use it once to bubble out the gunk, but don't overdo it. It damages tissue. Vodka or whiskey? Save it for later. Alcohol stings like hell, doesn't sterilize as well as you think, and you'll probably need it more for the psychological damage. Pat the area dry with a clean cloth, or the cleanest one you've got. Let's be honest, nothing's truly clean anymore. Step 4. Pack the wound, because holes don't magically close themselves. If the bullet went clean through, entry and exit, you've got 2 problems. If it didn't, you've got 1 hole and a piece of metal playing hide and seek with your vital organs. Either way, you need to pack it. Find sterile gauze. If not, find clean gauze. If not, the cleanest piece of fabric you can. Rip it into strips if you have to. Start at the deepest part of the wound. Gently but firmly push the gauze in with your fingers or tweezers. Don't cram it all at once, layer it. Think of it like you're stuffing a tiny horrifying turkey. The goal, fill the entire cavity to apply internal pressure. Don't pack it too tight, you'll cut off circulation. Don't pack it too loose and it's useless. Aim for firm but forgiving and like a mediocre handshake. If there's an exit wound, do the same thing there too. Once both are packed, cover them with a larger dressing and tape it down. Medical tape is best. Duct tape works in a pinch. Scotch tape, a joke. But if it's all you have, layer it thick because your life depends on it. Step 5. Antibiotics. The difference between survival and sepsis. Infection is the silent killer that comes after the main event. A bullet might miss your heart, but bacteria doesn't care about your luck. If you've got antibiotics, amoxicillin, doxycycline, anything broad spectrum, start taking them. Follow the dosage, don't skip a day because you feel fine. Feeling fine is a lie your body tells you right before it quits. No antibiotics? Don't panic. Find honey. Real honey, not that corn syrup in a bear-shaped bottle. Smear it on the wound before you dress it. Science and desperation both agree it helps. No honey, garlic. Crush it, mix with oil, apply it to the gauze. You'll smell like an Italian restaurant, but you might just stave off a fatal infection. Step 6. Monitor for shock, your body's silent betrayal. Shock kills more people than the actual injury. Watch for pale skin, racing pulse, shallow breathing, confusion, cold sweats. If you feel it coming on, lie down. Elevate your legs, get warm. Blankets, jackets, anything. Sip water, don't chug it. The why and the when. Your body is already trying to save you. Blood clots are microscopic sandbags. Pressure helps them build the dam faster. A tourniquet buys time. Packing creates internal pressure. Antibiotics and or honey help you kill the invaders. Survive the first hour, your odds double. Survive the first day, you might make it. And that's the punchline. No hospital, no doctor. Just you, some makeshift supplies, and the stubborn refusal to die on a dirty floor. But look at you. The wound is packed. The bleeding has stopped. You're still breathing. In this world, and that's a win. If the pain fades and fever never comes, congratulations, you survived. If it turns red, swells, and smells like death, well, you tried. And out here, trying is worth something. Now get up. You've got a bullet to dig out later, or a grave to avoid. Either way, you're not done.